Hello everyone, I hope you all are well and enjoying your weekend at home. And I'm back with the series Hello, my name is Dandruff. Today is episode 5, where we're going to continue talking about some questions I'm going to answer and then a little bit about the medicated shampoos. So let's start with the questions. I don't want to keep it too long. So the first one was, what exactly makes dandruff worse? So there were so many questions, kind of similar pattern, and that if people are going out, would that affect the dandruff? If there is any diet factor, does that affect the dandruff? What exactly it is which affects the dandruff? So I usually, when I'm doing my when I'm seeing clients in my clinic, dermatology, or in my private clinic, how I define dandruff, or in a hair loss clinic especially, is that it is based on two different things. First is the internal factors, and the second are the external factors. So you can't just pick and choose that there is only one thing. If you avoid that, then that is going to make your symptoms better. It does not work that way. So when we say let's divide that internal and external factors, external factors means that you're going out all the time. Sunlight is there. Now, the most important thing which you need to understand that even if you don't see sun physically present, you're still absorbing a lot of light and you're still absorbing a lot of rays. So that is still there. So that's really, really important. Then the artificial light, which I also have mentioned yesterday in the photo aging thing, that also affects your scalp because your scalp is absorbing that, and that's the first kind of contact anyway. So yes, that is going to make it worse. Then if you are going through some light treatment, so many skin conditions like psoriasis, or certain skin cancers, we also use a light treatment, which we just kind of change a little bit of that. It's a specialized light treatment in the dermatology center. And that also increases your risk for further damage. So if you're having any of these things, yes, that's going to affect it. If you come back from a holiday, your exposure has suddenly increased. So you have to be careful during that situation. That can mask it. Now, many people, they go on a holiday trip, and especially the beach holidays. So that beach water, is quite difficult anyway. So that affects the normal hair growth. And swimming pool, there's chlorine, there is a lot of other stuff that can affect it. Then external factors also involves exercise. So sweating blocks everything, and that is going to mask it. What else? So, and shampoos, yes. So anything which you are using on daily basis, your daily routine is going to affect that as well. Either it's a medicated shampoo or it's a simple shampoo. That plays an important role. And shower, how often you're taking shower and what time of the day you're taking shower as well. Another most important thing is your beddings. So people, they focus on, they actually don't focus on that thing. So for example, imagine that you've come back from a gym or whatever, or from work, and you've just gone to bed. There's a lot of sweat present there, and you've used that towel, not the towel, sorry, you've used the pillow. And oil actually tends to kind of, stay there. So if you're using that constantly, it is your skin is absorbing that oil as well. So just be careful. Changing the beddings is really, really important. So let's focus a little bit on the internal factors. So internal factors, again, diet plays an important role. If you're dehydrated, that plays an important role. And people who eat a lot of carbs, because carbs usually, I did mention, and those who have not kind of watched that, please go and watch the other series, which is which I did, especially on the carbohydrates, how it works and how it's broken down in your body. That increases the inflammation as well. So this is an inflammatory condition. Anything which you're going to eat is going to mask it. So that's important. Exercise I've already mentioned. Genetics, yes, plays a very, very important role. Certain types of genes you cannot, genes you cannot control anyway. So people like us, Asians, we have, by default, an oily skin. So I have to look after my skin far more than somebody with a fair skin type anyway, okay? Then what else? So then yes, illnesses. So if you're suffering with any other conditions, like other inflammatory conditions like eczema, psoriasis, or any alopecia or anything like that, that also affects the hair. And remember that I did mention in, I think in the first or second episode, we have gone through a little bit how the hair gland sits and next to the oil gland. So they both are together. So that can affect the shaft of the hair, which means the natural process of the hair cycle will be affected. So that's the answer to all of these questions, what factors affect it. There were so many questions about psoriasis and seborrheic dermatitis. Now, I think I did answer that in the last live. So let me clarify that psoriasis is a different condition than seborrheic dermatitis or dandruff. However, because it causes scaling, so the effect you're going to have or the symptoms you're going to have will be the same. So the only difference is that in psoriasis, because the skin cell turnover is so fast that your body is struggling to get rid of the dead cells, so they are kind of piling one on the top of another. When that happens, it brings a lot of blood supply, and that kind of exaggerate the process. So skin cells, they kind of multiply faster. Now, the skin cell turnover is also similar in seborrheic dermatitis, but that purely because of the presence of a fungus. So if we can control the fungus, because fungus is eating the dead cells and the oil, we can control a lot of this thing. However, in psoriasis, it's an autoimmune condition, so it's nothing to do with fungus. It's a condition you can never control. You can never cure. You can only control the symptoms. So there is something wrong at a bigger scale in psoriasis. So that's why, and both of these things are together, can come together as well. I think in psoriasis patients, if in one clinic of a psoriasis patient, if they are like maybe, for example, 10 patients, about I think 7 or 8, they actually suffer with psoriasis. It is very, very common. The reason behind that is because in psoriasis, we use a lot of steroids, and similarly in eczema and dermatitis, we use a lot of topical steroids. Steroids creates a best medium for fungus to grow. So it provides a damp environment. So that's the reason, so it's perfectly fine. You just have to control the symptoms, and it can come back. It's an intermittent, it's a remitting and relapsing type of condition. It's not something which you treated once and it will never come back. And this is similar in psoriasis and dandruff as well, okay? The other question was oral antifungals. What shall we do? Because we have tried nearly all the medicated shampoos and it hasn't worked. And my doctor has mentioned about the oral antifungals. Okay, so you can take oral antifungals, which is perfectly fine. They are safe medications, however, not safe. When I say that, because I see a lot of clients, especially with nail conditions as well. Fungal nails are very common as well. And because people can buy oral antifungals from the over-the-counter. So they go onto a course themselves, maybe 3 months or 6 months. Now, you need to be careful that antifungals, oral antifungals, they have a lot of problems as well associated with it. So, like when I go and see a rash or sudden, drug rash, at least 50% of these start after somebody is on oral antifungals. So, they can cause really, really weird problems as well. So, it's not that 100% safe. You have to be careful, and I do not recommend anybody taking oral antifungals without the recommendation of doctors. So in your situation, yes, your doctor has recommended, perfectly fine. However, the few things you need to be careful that the few things you need to be careful that it affects your liver. So when I start somebody on oral antifungals, I usually make sure that the liver functions at the baseline are normal, because for the scalp it's unusual. I'm not going to give them maybe for more than a week or 2 weeks maximum, or sometimes a month, but the dose will differ. For nails, hand, or the toenails, the treatment is different. It can vary from 3 months to 6 months. So if you're starting on such a big treatment, you have to be careful that it's not going to affect your liver. And trust me, your liver functions, your liver is really, really important. So that's the answer to that. Then the petroleum jelly, can I use the petroleum jelly? Okay, you can use the petroleum jelly. Now, again, the same thing is that because the dryness has been caused due to inflammation. So if you remember the process, which I've tried to explain on multiple occasions, that inflammation causes dryness, dryness causes further inflammation. So petroleum jelly is something which is kind of formed in oil. So it's quite thick in consistency. So if dryness, because you're using other medicated shampoos, is one of the main problems, you can use a little bit of petroleum jelly, maybe just in the roots of your scalp. It may work. If you're not using any of the treatments and you're just literally using petroleum jelly, then it's going to block the oil glands, right? So imagine that all the oil glands are sitting there and we're trying to get rid of that surface debris, right? So if you're putting the petroleum jelly on the top, it will just block everything. So in that situation, it's not going to work. So you have to be careful at what point you're using it and how you're applying it, okay? So what else? So there was another thing about the napkin rash. Okay, so I did mention that I'm going to do a separate dandruff in kids, because the treatment is a little bit tricky, so we need to go through, and the different rashes which kids can have purely because of this as well. And we are starting something what we call Skinzo Kids Club, where we're going to focus purely on the kids' skin, because pediatric dermatology is a big part of my work, and we have to handle it in a different way. So we will talk more about parenting, how you can help your child, and we will be bringing some kids as well, so it's a different thing, but you have to bear with me for a few more weeks for us to kind of properly launch it. Until then, just to touch base, the napkin rash. So the reason why we call it napkin rash is because it's a rash which is in the folds. So if you fold a napkin and you open it, that folded line is always there. So in the napkin rash, the rash is in the folded lines, and it is a fungal rash. It's more common in children, and we call it an infantile rash. So I like to name the medical terms as well. That's purely because if you see a doctor, many doctors, they prefer to only use the medical terms. Then at least you know what we're talking about. The treatment is, yes, antifungal creams you can buy. Sometimes shampoos, we also use it. And it's okay to dilute the shampoo and apply it in that area. But please, because it's a kid's skin, so I do not recommend anybody to apply these things or diagnose on your own, especially these fungal rashes in kids. So yes, you have to see a specialist before you apply any of these things, okay? What else? So there was another thing that how do we diagnose it? Okay, so fungal rashes are purely, it's a diagnosis of exclusion, how we call it. So if I'm seeing a fungal rash, I know just purely by looking at the rash, this is fungal, about 95%. Now in 5% situations where we're not sure for multiple reasons, if it's a combination rash, or it's not getting better with the treatment which we're giving, or suddenly it's kind of spreading, at that situation we take skin scrapings. Now skin scrapings are also important when you send it to the lab. You don't do it yourself because you can cause trauma. So it is simple, but it's simple for the doctors to do it, not for anybody. Because it's a simple surgical scalpel blade, we take it and we literally take the scrapings from the top layer of the skin. Now it's also important because if you're not taking the scrapings right, and if the skin starts bleeding at that time, so the result may not be the right. So that's important. But yes, you can go and have skin scrapings done, and you can have a treatment accordingly. So I think I've covered nearly all the questions. Few others, these ones will go into the next episode. So today we're going to talk about the medicated shampoo again, continue. Let's focus on selenium sulfate. So selenium sulfate, it comes in Selsun. That's the other name. You can buy it over the counter. It's quite good and it's quite mild to use. Few things again you have to be careful because it's a medicated shampoo. How it works, it actually kind of slow down the skin cells, and it works again on the proteins on the hair protein as well. So it is trying to kind of maintain that balance for the fungus not to misbehave. Just like I've discussed the other, in the past 2 other shampoos. So 99% all the medicated shampoos, they work exactly same. So one is different than other purely according to your tolerance. Now, if you cannot tolerate this shampoo, it has selenium in there. The only 2 things you have to be careful that if you are pregnant, you must not use it because selenium does get absorbed through the skin. And there's not like a lot of evidence that it suggests that anything harmful is going to happen. But it's always a cautious written in our in further literature. So we don't recommend that. So just be careful with it. In children, it can cause, you can use in children again, and yourself, but it can cause sometimes a lot of irritation to the skin. So, and you should not be you should never use any of these shampoos, once or twice or three times a week. Sometimes we as a specialist use this. I have used it even 5 times in a week in somebody, but under very close observation. So if you think that this is benefiting you and increasing the frequency is going to help you, it's not going to happen that way, because imagine it's getting rid of a lot of the dead cells. So once there's not a lot of dead cells present anywhere, if you're applying that shampoo, it is going to cause more irritation to the normal part of your scalp as well. And as I've mentioned, when you're using the medicated shampoos, because they have further chemicals and medicines mixed together, when you go out, if you're not protecting, not using caps and hats, that's going to increase your sun damage area. And we see a lot of sun damage area purely because of the use of medicated shampoos where people have not covered themselves. Okay, that's really common. What else? So it's other ways you can use this. So how to use it? Similar. Maximum, you should not leave it onto your scalp for more than 10 minutes. So same way how I've mentioned the other coal tar preparations or the ketoconazole shampoo in the previous episodes, you apply it in the roots of your scalp and leave it for 5 to 10 minutes. So if the key to it is it's just your personal choice. So if after 5 minutes or even 3-4 minutes you start feeling that your scalp is a bit burning or really it's quite discomfort, so just wash it off. You don't have to leave it that way. I sometimes start many clients on even once every fortnight as well. So you just have to build the tolerance. None of the medications, even paracetamol, carry no risk. So sometimes people go wrong here. And they expect that, because they have a disease element, we have given a treatment, it's going to repair the disease element, but it's not going to cause any problems or it has no side effects. So please be careful. I know that all of us get very impatient and we want our condition to be treated very quick. But it's not fair to say that, the doctor has given you the wrong treatment. We see this a lot. It's the fact of the treatment and combined with multiple other reasons as well. So just be patient with it. Similarly, if applying that in your roots, just pure shampoo applying that in your roots is not it's causing a lot of irritation, you can dilute it, mix it in water. And sometimes I do tell my clients to after using the medicated shampoo, you can use a normal shampoo to wash it off. So that is going to flush away a lot of irritation as well. So the role of medicated shampoo, once you've applied it, it's like you've pasted it. So imagine this is a scalp, you've pasted it. It has the skin has kind of soaked it. It's gone deep. Now you've washed it. It does not mean it has not worked. So skin has absorbed it. Other way, sometimes in severe dandruff or in severe seborrheic dermatitis, I do ask my clients to take a steam. So which you can, if you have a standing shower, you can actually take steam that way as well. Or you can take it through a different steamer. What exactly steam does, so it actually takes away a lot of scales from your scalp. So imagine that if I'm putting a shampoo, painting it to the scalp, and this is my scalp. But on that scalp, if this is the scale, it's already present there. So when I'm painting it, it's actually getting stuck to the scale. It's not even touching the scalp. So in this situation, you're probably having 50% or maybe less of absorption of the medicated shampoo, not that the shampoo has not worked. So sometimes we use special, other chemicals or creams mixed together to get rid of the scales and then use the shampoo. So you can do it that way. That's perfectly fine. So similarly, once your situation is better because it's maintaining the balance at that area, you can use the shampoos either once in a week or once in fortnight or even once in a month. I don't have any scalp condition, but I like to use it purely because of because it maintains the pH of the scalp, and and it helps with the hair growth as well. So my favorite shampoo for me is something I use it Alpha Cell, which we're going to talk about next time, or I use it T-Gel. T-Gel is my everyday kind of a shampoo. And I did mention that in my first episode, how to go for the darker color, which is thick looking, is the one you go for it. I do not use any other shampoos actually. Very rarely I use other shampoos. Sometimes, but very rarely. So you can pick it that way as well. What else? I think that's all. So basically you can use the same shampoos. If you suffer with eczema, if you suffer with other skin conditions, it works exactly the same. The only other thing I forgot to mention is the selenium sulfate. So it can cause a bit of discoloration to your hair and to your scalp as well. So and especially when you're using these shampoos, if you're going for a hair dye that is going to mask it, you can have a contact dermatitis purely because of the combination of these two things. So be careful with that. And what else? I think that's all. So yeah, okay, so yeah, one last thing. With the selenium sulfate, it sometimes can cause a little bit of a haphazard medium to your scalp as well, which means that it can sometimes cause more dryness in one patch, and the other patch could be more oily. So if that happens, then just make sure that you're applying the equal amount everywhere. People forget to apply at the back of the neck as well. So that area usually tend to be more oily as compared to the front part, because that's easy access. So be careful with that. Plus, if you're on antibiotics, which dries up the oil glands, and then you're using these shampoos, so the dryness is already because of something different, and using the medicated shampoo, you're just masking the dryness path. You're not doing anything different. So in that situation, maybe you can just tone it down a little bit. You may not need to use it very often. And that will do the trick. So it does not, cause a lot of problem. I think the maximum effects which I get to see or I get to listen from my clients is that it was causing a lot of irritation. But that's it. So they're really well tolerated shampoos and easily available over the counter. So do try that. Write back to me. And I think this is enough for today. So until I see you next week, stay safe and look after yourself. And I will pick up all of these questions in the next episode.